Congressman Charles Boustany of Louisiana joins us. He is also, by the way, Dr. Cardiovascular Surgeon, to be specific. Congressman, thank you so much for joining us.
Oh, it's wonderful to be with you.
Before we shoot into health care, I want to get your reaction. Some conservatives have come out saying that this is an embarrassment that the president is receiving this award, saying he does not deserve it. Where do you stand on this honor today for the president?
Well, the committee made a decision to award the president. I think it's a terrific and wonderful honor for the president, and I think he struck the right tone that we have to get back to work. We have a number of major issues in front of us, both domestic and international, and Congress is ready to work with the president to solve those problems.
Speaking of solving the problem, the big one of health care reform, and you have been vocal about malpractice insurance and getting tort reform involved, and there are still many Republicans who say that their voices are not being heard here. This process is moving ahead, but where do you feel it stands at this point?
Well, I think clearly there are House bills. There are 3 of them that are in slightly different versions, and then the Senate has a big proposal with Senator Max Baucus's committee. They're very different, so I think we have a long way to go toward reconciling those 2 different factions. But you know, the bottom line is the most important thing we can do is get this right, to get the cost down for families and small businesses who are really struggling with the cost. And as a physician, the big concern I have is that I don't think we've got the necessary reform measures in place to really bring the cost down.
Well, Speaker Pelosi has said that the way to do that is public option. I want to play what she just had to say about the possibly being votes ready for a public option.
We're in a very good place because we have many good options, and that's why I'm so pleased about where we are. Through consensus, through discussion and the rest, the members have rallied to a place where there will be the votes for a public option. Now it's a question of which one.
Let me get you to respond to that.
Well, I think, first of all, I think the Speaker is still struggling to get the votes in the House. And my understanding in looking at the Senate is that this is really not going to have much in the way of legs, because a lot of Democratic senators have concerns about the government option the way it's been described. And so I think we have a ways to go in all this.
What about the Baucus proposal? I mean, it came in under what so many expected. It scored well. It would not increase the deficit. Would be a great benefit if it goes out the way it does. And we know these have to be combined, and the scoring will certainly change. But do you not find any optimism in what we saw with the Baucus plan or proposal?
While Senator Baucus was able to get it within certain CBO requirements, right, the problem we have with this is it does raise taxes on families. It does raise taxes to a number of the providers that are going to be passed on, that are going to cause an increase in insurance premiums across the board, in my opinion.
But
also,
that's not been proven at this point.
Well, I think
to be the case.
I think there are a number of experts who have major concerns about this, and that's why we need to flesh this out a little more. I think rushing to judgment before we really have all the facts is important. The other concern that I have with both sides, both the House and Senate, is that we have significant Medicare cuts in there that I think will hurt our seniors. As a physician with 20 years experience, I'm very concerned about the Medicare program, and I'm really concerned about nearly $500 billion in cuts to Medicare. What kind of impact is that going to have on the quality of care that seniors are getting and their access to care?
All right, Congressman Boustany, thank you so much. Obviously, there are many other angles to talk about this. We're out of time with this breaking news, but we greatly appreciate you responding to the news of the day and what is happening in healthcare. Thank you.
Glad to be with you. Thank you.
Then